Welcome again to our show, Dr. M Health Corner. Welcome, welcome. It's a Friday, 12:15 p.m. Mountain Standard Time, 2:15 p.m. Eastern Standard Time. Welcome. I hope everyone had a wonderful week. It's so beautiful right here in Calgary, Canada. And as you're coming in, I would like to hear from you where you're tuning from. I really appreciate that. I see people are coming on. Thank you so much. Welcome to our show. Today, I am discussing one of my favorite topics with one of my favorite people, Dr. Latonya here. She's a colleague, she's a friend. So basically, what I want us to talk about, I want us to talk about parenting and ADHD because ADHD tends to have a very negative connotation in our parenting. So I would like you to bring other friends, bring other parents. If you have any teacher friends, psychologists, counselors, pastors, grannies, grandpas, bring them on. Don't come here alone. I would like us to discuss this. So we're going to talk about this with Dr. Latonya because I feel Dr. Latonya will agree with me. There's so much said about ADHD and misunderstood, and actually a lot of myths. She's going to unpack all of that for us. But before we do that, I want to introduce you to my lovely friend here, Doc. Hello, Dr. Latonya. How are you doing?
I'm doing well. How are you?
I'm good. Thank you so much for taking time. I know you're busy. I really appreciate you coming on here. So basically, to our viewers, Dr. Latonya Thomas, she's out in the US. She has a very long CV, and I just want to bring it on to you guys. So basically, Dr. Latonya is a registered nurse. She practices full time as such, but otherwise, she went on and studied so much. She recently finished her PhD in nursing practice. She actually also has, as you see on the screen, she is a licensed legal nurse consultant. She's very good with legal components. So if there's any nurses here, come on and listen to this. And basically, one thing that really stood out for me and to me that this lady, she carries a lot of hats. She's been an optician. She also actually has passion for women. She gives confidence advice. After we've had our kids, sometimes we lose our groove, right, Dr. Latonya?
Yeah.
We lose our self-esteem, and sometimes we become so mindful and also very critical of ourselves. So she's a lady to talk to. She does all of that to help women build their self-esteem and, of course, build their being to rejuvenate and also feel themselves again. And of course, last year, she did an amazing presentation on their 46th annual Transcultural Nursing Conference, which was virtual. And I'm obviously thinking that maybe it could have been live as they had a 46th one. It was in October 2020. Doc, you're just amazing. Welcome again.
Thank you.
Thank you. Dr. Latonya, let's talk about ADHD. It's easy for us to forget about seeking help about this because, like I said in the beginning, it carries a heavy weight on parents. As we both know, we are parents. Tell us here, what is ADHD? What should parents look for? Like I said, I'm inviting our teacher friends here to pay attention to our kids when they're presenting to them, right?
Yes, ma'am. So most of the time, I know from personal experience being a registered nurse and taking care of kids, and just doing the research on ADHD, it's a huge stigma for for the kids and for the parents themselves to actually, move forward and to actually recognize. And it's hard to diagnose ADHD itself because it's such a multi-step process that you can't really just diagnose immediately. So they have to go through steps. They have exams, medical exams that they go through. They do hearing and screen and vision screening tests, and just getting interviews from the parents, the teachers, the school, and the kids themselves to know. But some things there's three different types. So you can be um, hyperactive, where that's basically the child is actually showing signs where they're fidgeting, can't sit still, talking too much, talking fast. They may interrupt you while you're talking. Um, And then the other one is being inattentive. So basically, you notice these kids are probably just like daydreaming, staring off. They may not show other signs of being hyperactive and whatnot. They just, they have cognitive issues where they can't focus enough. And then the third type is basically being combined with those two. So you want to actually pay attention to your children, pay attention to their activity levels, what they're doing. And then I also looked up, just the stigma itself. A lot of people don't believe that it's an actual diagnosis. Some people actually, they believe in it, but they don't know how to treat it. And then if they do and they're diagnosed, then they don't want to take medications for it because they have this huge stigma on psych medications. So it's a huge, huge topic, and it can affect a lot of different areas for children and the parents, self-esteem wise, just social economic status, just a lot of things can come into play with, dealing with a child having ADHD and actually getting that diagnosis.
You know what, Dr. Latonya, you mentioning stigma and self-esteem. This is what we see presenting to our medical clinics, where we see a parent bringing their child because they're frustrated. Because let's be honest, even parents, they are unable to contain, more especially when the child is presenting with a hyperactive type you mentioned. And unfortunately, what I usually say to these parents is, like I see right now in these 10 minutes of interaction with you and your child, as you could see, climbing, everywhere, touching my medical equipment. What do you think she or he presents like in the class? And remember, the teacher has 30 students or 25 students. And here's the thing, these teachers, some of them are not trained to look after that, right? So not to say these kids are like they are not competent, but the issue is they do need some special attention, more especially they are hyperactive type. So tell me, when do we diagnose ADHD? And of course, I'd like us to talk more on the symptomatology because, like you said, some of these kids are not hyperactive, and
Right.
those ones are easy to miss.
So I think it comes into play, diagnosis would probably be a major concern, when you start to notice, because even young kids younger than the age of 3 can show these signs and symptoms. You just have to really hone in and pay attention to your child's behavior, and focus on seeing what they're doing. If they're, some kids at that age, they're pretty active, they're digging in things. But if you see a constant nonstop behavior where it's, they're not listening, they don't have, they're just making decisions like, the child can be 6 years old, and if you're going to jump off the top of a bridge, there's consequences. But those children, when they get to that age, they don't realize those consequences. They don't think about those things. They just do. They just go and move forward. So that's when we come in as parents and healthcare workers. If that parent comes in frustrated, sitting down, talking with us, letting us know, then we can start to do those medical exams and start, honing in and trying to figure out how we need to move forward. And if this child is going to be diagnosed, how are we going to treat it? If we're going to do behavior therapy and medication, are we going to get a psychologist involved, so they can have another outlet to speak with someone, because it can be frustrating. And even with, the kids in school, the teachers are not prone to deal with these things. So it is a difficult aspect for them to take on. And it more so comes off as these kids aren't capable, they don't have the knowledge, and they can't move forward, and they have that self-esteem, that, competence barrier. But they are pretty capable. They just need that extra support and actually honing in. So that starts at home with the parents actually recognizing these symptoms, and us actually starting the process to get the child tested and knowing which route we're going to go and if they're going to be diagnosed with it.
Loved it. You know what? It's interesting you also mentioned that part of the other students, because a lot of times these kids come to me stressed about no one wants to be their friend, because there's that impulsivity in most of them, right? They don't wait their turn, a lot of that stuff. And unfortunately, it can be frustrating because also other kids are unable to deal with it, because they're still learning to regulate their own emotions, right?
Yeah.
And you know what, Dr. Latonya, tell me, how do we differentiate between this and anxiety? Because I've seen these kids sometimes, they usually present with that anxious type, and then it's easy to mask, the ADHD symptoms. And we've seen a lot of people actually going into adulthood. One time I did a talk here where I know of a lot of adults, and they are very creative. I have a lot of colleagues that have ADHD. They are very creative, but they were misdiagnosed or basically never diagnosed at all, even in childhood.
I think the main difference, being able to decipher through the two from anxiety. Anxiety is something that it can affect you physically. Um, when I say like you show physical signs where you're having difficulty breathing, you're having chest pain, the child's heart rate is up, like they telling you that they feel like their heart is beating out of their chest. That's a different aspect of anxiety, and that could be the main factor differentiating between ADHD and actual anxiety itself, because ADHD is basically, they're hyperactive. Either they're jumping, moving around, you can't get them to sit still. And then the inattentive version of it, they're basically not focused. They're not paying attention. So you really don't have those other signs to hone in. So that's when it comes into play with our assessment skills of asking, hey, how is the child feeling? Let me ask these questions. Are you having these signs and symptoms? Are you having difficulty breathing? Is this a situation? Like, let me actually assess and dive into the situation to kind of differentiate between the two.
I love it, because the reason I ask that, a lot of times I find parents coming in saying, I think my child has anxiety, and I guess also it also has that stigma. Maybe to them it carries less stigma when they say the child has anxiety. It's when we unpack it. And maybe you want to share with us, say, what are the causes of ADHD? Because there's a lot of myths out there. There's been a lot of things people talk about, immunizations, of autism. There's a lot of things that are out there. I'd like you to clarify.
So basically, there is no definitive cause that research is showing, that they designated to causing ADHD. Um, the only thing that I did see that there is a genetic predisposition for it, but there's nothing definite set in stone to say, oh yeah, this is what's going to cause ADHD. So a lot of times they're doing research to say here and there to try to find a correlation between the two with their research and amongst the things, but they still haven't had anything to kind of say set in stone that this is what causes ADHD.
Right, wonderful. Yes. So tell me, Tanya, now your child comes in, the patient is in front of you. How do we get parents to accept the diagnosis? How do we get them to see the bigger picture? Like I said, a lot of times people come and complain that they are frustrated with their child who is constantly having low grades. And immediately we treat ADHD, their grades go up, the child's self esteem goes up. So, how do we convince parents here who are watching us?
I think the biggest thing is education. Education goes a long way. And I learned that from doing my manuscript for my doctoral capstone, and I honed in on doing education. Education for anything across the board will actually help, the patient, the family, anything. And then even going additional, like if it is something that, they're not accepting, and you show them the bigger picture, you give them the bigger picture, then that's something that we need to probably, further advance and get the parents some counseling or some assistance to actually, sit down with them and give them their alternatives to let them know, hey, this is the situation and this is what it could be. But do you want does the risk outweigh the benefits, basically, for your child and for your sake? Um, Even though there is this huge stigma that comes along with it, it could make a huge difference in your life and in your child's life. So that's something that you have is education. Education is the key to anything.
You're right. You're right. Actually, it's interesting you're mentioning that. I remember looking at a study that was done at Yale University where these parents were concerned about their children who had severe anxiety. And, the pediatricians and the child psychiatrists, they actually started with the parents themselves. They counseled, because a lot of times we are us parents are the ones struggling in these issues, not necessarily with the ADHD. So fantastic. We have to do the education. It could never be enough. Sometimes, people talk about diet. Can you talk about that? Because I know that it does contribute to how, most especially the kids with the hyperactive type, what to avoid.
I think, and I did some research. So that's another factor that they try to correlate. If your kids watching too much television, if they're eating too much junky foods, and not enough vegetables, and which at the age that I am now, I think a healthy diet is the best approach for anything across the board at this point, because literally there are some of these disorders that are affected by things that you eat and things that you partake in. So it's a lot of limiting, certain foods, making sure they're being healthy, making sure they're eating everything that they need to partake on, because that can play a big role too.
Yes, yes, yes. I always encourage my parents to, less sugars, the level of sugar. And, even you look at even there's this product parents love the most, Nutella.
Oh
There's
yes.
so much sugar. And you know what? Unfortunately, kids, they love it. If we're not intentional and paying attention, because I mean, it could even affect your dental care, right? So
Yes.
thanks for mentioning that. I always also throw in maybe omega-3s. I've seen it on research. They talk about that too. So what medications are out there, Dr. Hell? Because, I know people are like, okay, where do I start? There's so many out there.
I think there's a huge array. Some that I've seen personally is like Ritalin, Concerta, and I know a lot of those medications, they're not gonna really, it takes some evaluation, and once they hone in and figure out how they're gonna tackle it. If it's just gonna be medication therapy, then they may take a different route. If it's gonna be medication and behavioral, then they may take a different route as well with that medication. So I think it'll all come together once they have that solid diagnosis, and they decide, the family decides which way they're going to go with their options of treatment. And then that doctor can actually prescribe. And then if that doctor, sometimes I've seen psychologists can get involved, psychiatrists can get involved and take care. And then another thing, a lot of these kids, they have ADHD, but then they also have conduct disorders as well. So usually it's sometimes it's a mixture of things. So that's when it comes in, it can get really tricky on making a decision on how they're going to move forward with medication therapy or whatnot. And then personally, I know I had a family member that was diagnosed, and the teacher was calling home saying that the child was having issues and doing this and doing that, and his mom, she took him to the doctor. They diagnosed, they did things, they started medication therapy. But then that medication that they started him on made him so groggy, sleepy, that he couldn't even focus in class. So as I say, it comes into play on how you have to see how you're going to move forward, how they're going to treat it. And then you have to actually see if that treatment is actually going to be effective. So it takes a lot of close monitoring and following up with the patients and having these things and all together to actually move forward and it be successful. So I would tell them to start, you start with that evaluation, and then you can move forward from there.
Yes, yes. You mentioning conduct disorder. This is when we see kids. I remember growing up in South Africa, and I feel bad. There's kids that dropped out of school, Dr. Latonya, and probably it's situations like this. And at the time, I in my school there were never psychologists at school. We never had that to assess these children, right? So these are the kids that unfortunately didn't get the opportunity to further their studies. And like we said, this is not an abnormality or something that would say they have mental retardation. These kids are capable.
Yes.
Unfortunately, they just need to have the mind reset in terms of their brains. They just to regulate them. I'm glad you mentioned that, because that's when we start seeing also, like I said, the dropouts or kids being involved in bullying because they're frustrated, right? They are crying for help. Right. I'm glad parents are still here watching us. Okay. So tell me, Dr. Latonya, we're going to close here shortly. Now, how do we help teachers. I know that there's so many things like non-medical, and of course, just to mention to what you said, I always emphasize monitoring these kids' weight because their medication sometimes could affect their diet, their appetite. So we always want to do that baseline weight and check and basically see what works. Sometimes we do a morning dose that would last that 8 hours the child is in school. So like you said, you're right, we just need to see what works better, because one medication could be sedative and another one could be okay for your child. So we need willing caregivers here. And I love that you mentioned the involvement of the psychological aspect, because we want to build their self-esteem and for them not to feel different from others, right?
Yes.
So how do we get the schools involved? Like with the stigma, because parents sometimes withhold all of this. Some kids, they need another dose, while they still at school.
So I think, for me doing a little bit of school nursing as well, I think the biggest thing is actually having that open line of communication between the family and the school themselves. And me being here in Texas, where I am, one of the fourth largest cities in the United States, there are still some schools that don't have a school nurse that's full-time for them. So that plays a role as well. So a lot of times you need to have someone that can bridge that gap. So if it is something that this child may need another dose of medication, or just knowing that what medications that child actually took that morning, because sometimes these kids take medicine. I can tell you, I had a child that came in the office and literally she was like, "Oh, I took some medicine. I take medicine every day." And I'm like, what do you take medicine for? So I'm trying to find the history in the school and I can't find anything. So there was that lack of communication and not knowing what am I assessing for? What am I, looking for? Because now the teacher's asking me, "Hey, she needs to go eat lunch early because she takes such and such medicine. She tells me at home, but she doesn't know the medication." So it all comes into play of communication, knowing what those, if they are diagnosed and what they're taking, and having a record of that for the school nurse and for the teachers themselves. So the teacher can communicate to me and let me know, "Hey, this is going on in my classroom. I need this done. Can you figure out what needs to be done to correct this?" Or even if the child needs to take medication during the day, like you can actually accommodate those situations a little bit better if you know and you have that education.
I love it. I love it. Because, like I said, when we start educating the parents, we lift that stigma. There's acceptance, and I've seen sometimes both parents, most especially in cases of divorce, the other parent wouldn't give the child the medication and the child suffers. It's always important. The other trick I always do is to call those parents in, irrespective of how they separated or divorced, because I know this child would visit dad and would visit mom sometimes, both times. But the key thing is that that education, and also having those blatant, honest conversations with them, right?
Yes.
Yeah, because truly, unfortunately, sometimes these kids don't progress academically, and sometimes ADHD kids don't necessarily go the academic route. Some are very good with sport or an instrument. And like you said, it's just that matter of understanding your child and the capability, what's good, and using that positive psychology, what is he or she good at, right? And embracing those strengths. I love it. I love it. I love it. You know what? Actually, sometimes I've seen some parents suddenly treating this child now differently from others. Can you talk about that? Because it does, unfortunately, negatively affect the child negatively.
A lot of times I think, when you have kids, and I learned that once I had my son, you want them to be this perfect being and not have anything wrong with them. So you look at the situation differently. So when they do tell you that that child has something, because I know my son had a heart defect, and we found out immediately once we found out the sex of the baby. So that affected me instantly during the pregnancy as well. So I mean, the whole time I'm like, no, I don't know, what's going on with him. How are we gonna deal with this? Like, is it gonna cause any problems? Like, how am I gonna move forward? Like, and you think about, am I gonna have to treat this child differently because of such? And I mean, he turned out to be fine. I didn't have to, but I know my thought process. And then even looking at my mom, she lost her first daughter to congestive heart failure, and she waited a long time before she had another child. But she had two more kids after that, me and my brother. Um, but I still think if my sister was here, she probably would be getting treated differently because she had that congestive heart failure diagnosis. So my mom probably would have paid more attention to her, versus looking at the other child that's actually, stable, normal, no issues. So it all comes into play. It's back to education. You want these parents to know, hey, yes, this child has this diagnosis, but also you need to take into account that you have other children and you don't want them to feel isolated or alienated because of anything. And I mean, that's for the child that's diagnosed, and that's for your other kids that are going to be in the home as well. So you have to find that balance, and sometimes it takes some education and some time. So those parents may have to get on the same page if one feels a certain way and the other one doesn't. It's going to take that time and that balance and that education and actually recognizing, hey, I am doing this. This is what I'm doing, and I didn't realize I was doing this, because a lot of times it takes acceptance too. Because us as parents, sometimes we're not accepting of these ideas.
We don't. We don't. The thing is, again, it's also like I've also helped parents to stop the my child is crazy. There's this word sometimes parents use, the crazy word. It's not crazy, parents. And you know what? Protect your child from those words. Actually, stand up for your child, advocate, because when you do that in his or her presence, when people say that, your child trusts you and also gets to share stuff, because initially these kids, they have really hard time having those friendships that are long lasting in school, and at that moment they are still finding themselves, they are finding who they are, their best friends and all that stuff. So we really need to be out there and be advocates for them, right? I love it. And of course, I've seen so many groups also on social media, Facebook, has parents with ADHD kids. There's a lot of advice that's out there. People, okay, Ritalin doesn't work for mine. Okay, let's try Vyvanse. There's so many medications out there. Love it, love it. Okay, Tanya, let's sum up right now. Can you share a word, and of course, share with our viewers here how to find you? I have a lot of people in the States here in Texas.
So I have a Facebook account and I have Instagram account. I have two businesses as well. So I have direct links for those websites. And then I'm on LinkedIn, so they can find me on LinkedIn. Um, and I think you guys have everything on the Black Matters mental health website as well. So those links were sent over as well. Um, but at any time, if they need me, my email is on those pages as well if they want to reach out to me or have any questions or any concerns.
I love it. Women, most especially with this pandemic, people have time, to look after themselves, Dr. Latonya, and also to go deep inside themselves and work on that self-esteem, because sometimes if we are not complete or we're not feeling the confidence in ourselves, we are unable to help our little ones, right? So honestly, these kids, they really need support from very empowered parents or caregivers. Thank you so much, Doc. Of course, I'm gonna leave your details here for our viewers. Thank you. I can see people are still watching. And of course, next week we're gonna come back here, same time, same place. I bring all these healthcare leaders to come and teach us, because the biggest thing I find is usually we sometimes grab any myth we know about and run with it. So the purpose of this show is to eradicate all those myths so that we can be informed and make better decisions for ourselves and for our families, most especially for our kids, because remember, our kids, they rely on us. They cannot make these decisions. So an empowered parent empowers his or her child. And of course, these are our leaders. These are tomorrow's leaders. And like I said, I have so many colleagues I know of, Dr. Latonya, who have ADHD, who are so creative. They're so creative, and I'm inspired all the time. in their midst because they are so creative. You just wonder how they do it. I'm so creative. I sometimes wonder if I'm not. And actually, I always tell my friends, you guys, you better do the diagnostics on me because honestly, it could affect anyone. It doesn't choose any socioeconomic class. ADHD, actually, to our viewers here, unfortunately, if it's not diagnosed in childhood, there's a myth people think, oh, he will grow out of it. There's that, Dr. Latonya. Have you heard that?
Yes, and the research that I've seen, most of the time they're diagnosed in childhood, and it still progresses and follows them into adulthood. And then sometimes if they're not diagnosed in childhood, you can still have it in adulthood. So it's just that misdiagnosis of actually, figuring out what's going on with you and what you have.
Guess what? I listen to adults actually who come to my clinic saying, you know what, my relationship, I'm losing my relationship, doc. My spouse cannot stand this. I'm very impulsive. And remember, in adults, it doesn't necessarily have to be the fidgety. It's actually how you are managing your funds. You don't make decisions with your spouse. You impulsively buy stuff. You never budget for these things. Impulsive, even in the conversations, how you come across, how you express yourself emotionally. These are the things people deal with. And of course, let's talk about workplace where these kids grow up into adults. All right? They grow up into adults, very capable. They finish college. Now they are out on the field. They move from one job to the other. That's usually the sign people have. They move from one job to the other. Or maybe even their seniors, they don't understand them. They are fired, and then it can frustrate them. And it leads to other things like drug abuse now, right? Because you feel, what is wrong with me?
Yes.
Right? Yes, even in kids. Kids start asking themselves, what is wrong with me? I'm different. That's when they get into stuff like drug abuse because their self-esteem can be very low. So parents, I beg you, thank you so much, Dr. Latonya. I'm so loving this conversation. I wish we could talk more. Thank you so much for your time. We're going to come back here because I would like us to talk more about women and how to empower them, more especially postpartum, and also share your ideas, how you have coped with your own situation after you had your baby boy. Thank you so much to our viewers. You take care, and we'll love to see you again next week.
Yes, ma'am. Thank you.
Thank you.